This conference will now be recorded.
Okay, good morning, everybody. Is my voice audible?
Yes, sir.
Okay. So we will continue with the metallic poisons. So before that, we will have a small review. Then today we'll look into lead poisoning. We have already seen arsenic poisoning. So we know that classification of poisons, they are broadly divided into four. There are corrosives, irritants, systemic poisons, and miscellaneous poisons. And then corrosives, we have seen in irritants. Irritants are divided into organic, inorganic, and mechanical irritants. Inorganic irritants are again divided into metallic and non-metallic. Organic irritants are divided into plants and animals. And mechanical irritants, examples are diamond dust, hair, and glass, powdered glass. In non-metallic poisons, examples are phosphorus, chlorine, bromine, and iodine. Metallic poisons, we have arsenic, copper, lead, mercury, thallium, and zinc. And we have seen arsenic poisoning. And plant poisons, we have so many examples in plant poisons. We have delirium poisons, we have cardiac poisons, we have CNS poisons. So we cannot include every plant poison in this slide. So I have just left it open because the options are too many. So that's why there are n number of plant poisons. And then animal poisons, we have snakes, and then we have insect bites, we have scorpion bite, cantharides, fire ant bites. So this is a gross classification of what we are dealing. So I'm skipping all these things. We have seen about arsenic poisoning. Can anyone tell the main points in arsenic poisoning? So we know that in arsenic poisoning we have raindrop type of pigmentation, very important, on palms or on the body, raindrop type of pigmentation. And then we know that clinical feature, we have keratosis of palms and soles, very important. So raindrop type of pigmentation, and then we have keratosis of the palms and soles. And then another point is Mees lines. So these three clinical features are associated with arsenic poisoning. Mees lines, which are present on the finger, which are horizontal white lines, which represent arrested growth in nails. So they are called Mees lines. And then we have raindrop type of pigmentation, where macular brownish pigmentation is seen on the body and on the palms, where as if a person, if he is folding his hands in the rain, the droplets represents the raindrop. So as if the same features are stimulated, so it is called raindrop type of pigmentation. And then we have thickening of the soles and palms, which is called as hyperkeratosis of the palms and soles. So these are some of the features, clinical features of arsenic poisoning. And then we know arsenic, we have garlicky like odor. And then arsenic is an ideal poisoning, ideal homicidal poisoning, where it doesn't have much, it is very cheap, and then it will not alter the color of the food. when given to other person, it's homicide, and then it will mimic the natural disease. So arsenic poisoning mimics cholera disease. So the person who has taken arsenic will go to hospital or will say that he is having the symptoms of diarrhea and vomiting, and the doctor will treat him as if he is having suffering from cholera. So unless he takes a very good history, he may not find whether the person is suffering from arsenic. So it's a very ideal homicidal poisoning where the disease mimics a natural disease like cholera, and then it will not alter the color of the food taken, so it can be easily mixed with any fluid or any juice, and then it can be administered to the other person. So these are some of the brief findings of the arsenic poisoning. Today we will see about the lead poisoning. So lead poisoning is also one of the commonest metal poisoning which is involved in chronic poisoning. So most of the metallic poisonings we don't see any acute poisonings. So we know that all metallic poisons they accumulate in the body over a period of time. So mostly the industrial workers and the workers who are involved in metal industry who are exposed to a prolonged time, they are one who get these chronic poisoning symptoms. So what are the physical appearance of this lead poisoning? Lead is a heavy metal. It is steel gray color metal, and then these are some of the compounds that are used, which are used in some of the industries. Like lead acetate is used in therapeutics in pharmaceutical industries, and then lead carbonate, it is used in paints. Lead oxide is used in pottery, and then tetraethyl lead is an anti-knock in petrol. This is commonly in the past it is used. Anti-knock means where it will not, the engine will not have a sound because of this tetraethyl lead, and then it will not self-ignite beyond some temperature. So only if you switch on the ignition, it will ignite. So this is called anti-knock property. So the sound of the engine will not be there if there is tetraethyl lead. So these are some of the things, and that's why we know in petrol pumps, if you have seen in the petrol bunks where previously they are leaded petrol, now everything is unleaded in order to prevent lead poisoning. So you can see on the petrol pump boxes, unleaded petrol, unleaded. It is written as unleaded. So previously it is leaded. Now, in order to avoid lead poisoning, it is unleaded. And then we have lead tetroxide, which is used in cosmetics, and vermilion. Vermilion, where the female married woman will keep on the forehead, and also contains lead. And then those who use frequently and in large quantities, some of the minute imbibition through the skin has been poisoning has been noted. And the lead tetroxide is used in vermilion, and then lead sulfide is used in surma and eyeliners, even in makeup kits. In makeup kits, and mostly surma is where it is used by Muslim community, as if around the eyes. So it contains lead sulfide. So these are some of the compounds of lead which are used in different industries and their uses. So lead compounds are used in pharmaceuticals, in paints, in pottery, in petrol, anti-knock as an anti-knock agent, and then in cosmetics, in vermilion, and then surma and eyeliner. So what are the common sources of lead poisoning? Automobile exhaust is the most common source previously, but not now, because all petrol is now unleaded petrol. So we don't have any leaded petrol now. So all petrol has unleaded thing in order to prevent this lead poisoning. And then other source is battery making. Battery making, there is lead compounds are there. In house paints, lead is there. So mostly lead poisoning will occur in house with the children. children sometimes they will scrape the paint and then they can eat the paint. So even though they eat a little bit of amount of paint, but over a prolonged time, it can cause poisoning. And then toys and pencils can also have lead. Some people will eat the lead inside black color uh, uh, by the children. And then steel and building industries, cosmetics, and drinking water also contains lead. So these are some of the sources by which poisoning will occur to humans. And then what are the toxicokinetics? What will happen to the lead? What will happen to the lead if it enters the body? It is absorbed in all portals of entry. It is absorbed through oral route. It is absorbed through inhalation route. It is absorbed through skin imbibition. So it enters through every route possible, lead. And then occupational exposure is mainly by inhalation and then through skin. And then lead is stored in bone as phosphates. Very, very, very important. So lead is stored in the bone as phosphates and carbonates, and mainly in the metaphyses. That is the growing ends of the long bone. So the long bone contains three parts. We have epiphysis, we have metaphysis, and then we have diaphysis. The epiphysis is the topmost layer, and then the metaphysis is the growth zone. It is a very active cell replication zone. Osteophytes, osteocytes are replicating in a fast manner so that the length of the bone will increase. So it is here the lead is deposited. So that's why people with lead poisoning have a problem with the growth. So storage is stored in the bone as phosphates and carbonates, and is mainly in the growing end of the long bones, and it is observed as a lead line in X-ray. Very, very important. Lead lines in X-ray. Lead line is the deposits present in the long bones at the metaphyseal end of the long bones, and then it is seen as a lead line. And then we know any metal can be seen as a radioactive material in X-ray. So we can see these lead lines in X-ray. And excretion is through kidney and bile. So what is the mechanism of action of this lead poisoning? The lead, when it enters the body, it combines with the SH groups, which is nothing as sulfhydryl groups of enzymes, and then it inhibits the enzymes responsible for the synthesis of hemoglobin. Very, very important. Heme synthesis, and then hemoglobin synthesis, and then cytochrome synthesis. These three are inhibited. Mostly the hemoglobin synthesis. So lead, it combines with sulfhydryl group, SH group, sulfhydryl group of the enzymes, and they inhibit the enzymes which are responsible for the synthesis of heme, hemoglobin, and cytochrome. So because hemoglobin is not synthesized in RBC, thereby leading to hemolysis can occur, and then because the cytochrome, which is an enzyme for oxidation, is inhibited, it causes oxidative phosphorylation inhibition in the mitochondrial organelle, and then all these things can induce cell apoptosis, and then lead can have a direct cytotoxic effects on CNS, CVS, and then reproductive organs, mostly in females and also in males. It can cause sterility in males, it can cause abortion in females. So lead has a direct cytotoxic effects on major systems like CNS, CVS, and then reproductive organs. And mostly the mechanism of action is it binds with sulfhydryl groups, inhibits the enzymes of synthesis of heme, hemoglobin, and cytochrome. Thereby, it inhibits oxidation and then respiration and then hemolysis. So acute poisoning, we know that acute poisoning is very rare. Only in metallic poisons we have mostly chronic poisons. But what is the fatal dose is 20 grams of lead acetate, and then 40 grams of lead carbonate is the fatal dose. Fatal dose is 20 grams of lead acetate and 40 grams of lead carbonate. Fatal period is 1 to 2 days. 24 to 48 hours. Fatal period is 24 to 48 hours. So for every metallic poisoning or for any poisoning, I told you what to remember or how to present in examination is you have to know the poison, the mechanism of action on the body, or toxicokinetics, and then you have to know the fatal dose, the fatal period, and then you have to know the symptomatology that the poison is causing on the body, and then you have to know the management, how to diagnose the poisoning, and then how to treat the poisoning, and then fifthly, what is the medical legal importance of this poisoning. So this is what a student has to learn from any poisoning. So fatal dose 20 grams lead acetate, 40 grams lead carbonate, fatal period 1 to 2 days. And what are the symptomatology in acute poisoning? The patient will have metallic taste, dry throat, there is intense thirst, abdominal pain, very, very important. In lead poisoning, we have burning abdominal pain with nausea and vomiting, GI symptoms, and then the patient can experience headache and then loss of sleep. There is peripheral circulatory collapse can occur, and then the patient can land in coma and death. So these are some of the symptoms of acute poisoning. There is metallic taste, dry throat, thirst, abdominal pain, nausea, vomiting, headache, insomnia, vascular collapse, and then coma and death. What are the laboratory findings? Estimation of porphyrin in blood and urine is very, very important. In the synthesis of heme or hemoglobin, these porphyrins are formed before the hemoglobin is synthesized, like protoporphyrin. So all these porphyrins are formed in the process of synthesis of heme. So because the lead is absent or because the lead poisoning occurs, it inhibits the enzyme which is used in the synthesis of heme. These pre-products like protoporphyrin, all they are increased in the blood and urine. So if you find out increased amounts of porphyrin in the blood and urine, that indicates that the person is suffering from lead poisoning or there is some abnormality in the synthesis of heme. So what are the values in urine? If it is about 0.15 to 0.3 milligrams, then it shows that the person is having lead poisoning. And the blood, if it is greater than 0.07 milligrams of porphyrin, then it indicates the blood. So these are the values which shows that there is a problem with the heme synthesis where the pre-products are increased in the blood because of the lead content, and then which inhibits the enzyme in the synthesis of heme. So what is the treatment we give? Gastric lavage, definitely if it is there by ingestion method, gastric lavage with sodium and magnesium sulfate, and then we give demulsions which coat the abdominal wall, the stomach wall. We can give egg white, we can give potatoes smash. So all these things are demulsions. We can give castor oil, olive oil. All these things are emulsions which soothe the gastric mucosa. And then very importantly, chelating therapy, very, very important, which is an antidote for lead poisoning, which is BAL, which is British anti-leucite chelating agent, chelating therapy. We know that chelation is where chela means claw. So claw-like structures which will bind the lead, and then it will remove and form as an inert substance, and then it will be excreted through the urine or whatever system. So chelation therapy with British anti-leucite and then calcium EDTA, and then penicillamine. So three chelating agents: BAL, calcium EDTA, and then penicillamine. And another is 5 milligrams of intravenous 10% calcium chloride can be given, cause migration of blood from the bones to the blood and thereby excretion. So this can also be given. So I told you the lead is deposited in the growing ends of the bone, mostly in metaphysis. So if you give calcium chloride 10% IV, 5 milligrams, this will cause the lead from the bones to move into the blood, and then from the blood it will go to the excretion through the urine. So thereby removing the lead from the body. And then finally, if it is mixing with the blood and if it is mixing with everything, then one more option is we have is dialysis. It can be peritoneal dialysis or hemodialysis. So treatment aspect: gastric lavage, demulcents, chelating agents, ball, calcium EDTA, penicillamine, and then 10% calcium chloride, and finally dialysis. Chronic poisoning. Chronic poisoning is very important, asked many times in the examination, otherwise called as plumbism, otherwise called as satanism. Chronic poisoning is called as plumbism or satanism. So what are the causes of this chronic poisoning? As we know that workers, industrial workers, occupational health workers. So occupational exposure in paint industry and among plumbers and glass polishers and printing industries. So printing industries, paint industries, plumbers and glass polishers are the one who are exposed to this chronic poisoning of lead. And then chewing and licking of toys among children. So lead toys are there. So constantly children, they keep the toys inside in their mouth, and then this kind of constant rubbing can cause a small amount of lead to go through the mouth. And then absorption of vermilion applied to the scalp. So mostly the Hindu married women, they apply vermilion on their foreheads, so which contains lead. So if they constantly apply and then for a prolonged time, then there is every chance that there is a minute amount of chronic lead poisoning can occur. And then long-term use of hair dyes and cosmetics containing lead can also cause chronic poisoning. What are the signs and symptoms? Very, very important: facial pallor. First signs and symptom is facial pallor. We know that why pallor is there a symptom of anemia. So if anybody is anemic, then the person will look pale. Why there is anemia? We have known that it inhibits heme synthesis, hemoglobin synthesis. Because of the heme synthesis is inhibited, there is anemia. So the person will look paler. Facial pallor will be there, which is the most earliest and consistent sign. Very, very important. It is the earliest sign of lead poisoning, that to chronic lead poisoning. It can be seen around the mouth, and then it is mostly due to vasospasm of the vessels on the face. And also one more important thing is because of the hemoglobin inhibition. So another thing is anemia. So first one is facial pallor, which is due to vasospasm. Another is due to anemia. Anemia is due to decreased survival time of RBCs and then inhibition of heme synthesis. And now the lead poisoning will inhibit ALA synthase. Very, very important. Which enzyme is inhibited in heme synthesis by the lead? Answer is ALA synthase. ALA stands for amino-lubulinic acid synthase. Amino-lubulinic acid synthase. ALA synthase. So ALA synthase inhibited by the lead in chronic poisoning, thereby the heme synthesis, hemoglobin synthesis inhibited, thereby the RBC survival is decreased. Anemia is associated with polychromasia and then basophilic stippling. Very, very important. Or punctate basophilia. You know, if you watch the RBC under the microscope, you can see basophilic means blue color stippling. Blue color marks can be seen in the cytoplasm of the RBCs, and these blue color stipplings are nothing but the products of incomplete formation of heme synthesis. And then there can be reticulocytosis, anisocytosis. There is decrease in WBCs and platelet count. Mononuclear cells are increased, and then eosinophilia can be there. and then porphyrin excretion is greater than 500 micrograms per day. So because heme synthesis is affected, we have seen that the pre-products, which are porphyrin products, will be increased in the blood, and then they're excreted through urine, and then these products can be seen as a stipplings, are called as basophilic stippling or punctate basophilia. Very important. So punctate basophilia is a feature of lead poisoning. Basophilic stippling is a feature of lead poisoning. You can see here, this is the blood smear in lead poisoning. You can see here the arrow mark. This is an RPC. You can see violet color stippling. Violet color dots can be seen. These are nothing but basophilic stippling or punctate basophilia. Third one is lead line or Bartolian line. So the first symptom is facial pallor. The second is anemia. The third is lead line or Bartolian line. We have Mies lines in arsenic poisoning. We have lead line or Bartolian line in lead poisoning. So it is seen in about 50 to 70% of the cases. It is a blue line seen in subepithelial layer of the gums at the junction with the teeth. So blue lines are present at the junction of gums and the teeth, subepithelial layer, and only near the tear caries teeth, mouths, are the people who are not maintaining oral hygiene can be seen more these lead lines and Bartolian lines. They are usually seen in upper jaw, and sometimes it may be seen after 1 week of the exposure. And then it is due to why there is a, what is the reason for this lead line is because the formation of lead sulfide from the sulfide of the food. So the people who are not brushing their teeth regularly, who are not careful about their hygiene, oral hygiene, the food can be stuck between the teeth, and then which contains the sulfide and the lead present. Poisoning can react with this sulfide and then form a lead line, or otherwise called as Bartolian line. So it is almost seen in every case of a caries teeth persons, and then it is present mostly in upper jaw, and then it is between the gums and the teeth. So it is present in 50 to 70%. Lead line and Bartolian line. So you can see this is the lead line. So blue line can be seen, mostly not typical. Sometimes it can be seen here also as a junction. Fourth clinical feature is colic pain or abdominal pain. So first one is facial pallor, second one is anemia, third one is Bartolian line or lead line, fourth one is colic pain. So colic pain means, colic pain means spasmodic pain, nothing but spasmodic pain. It can be seen in the abdomen, by the intestine, it can be seen in the ureters, kidney, it can be seen in the uterus, and then it can be seen in the blood vessels also. So colic pain can be seen in mostly in any volume containing tubes, intestines, uterus, and then blood vessels. Occurs in 85% of the cases, and it is a delayed symptom. So what is the earliest symptom? Earliest symptom is the facial pallor, and the delayed symptom is colic pain. So colic pain occurs at night time, and it can be very severe, and the pain lasts for a few minutes but may recur for a few days and or weeks. So pain is very severe, mostly at night times it will be there. So it occurs from few minutes to few days, and then it occurs in 85% of cases, and it is also a delayed symptom. And colic pain can be seen in the intestine, it can be seen in the uterus, it can be ureter, it can be seen in the uterus, and then it can be seen in the blood vessel. So the fifth symptom is lead palsy. So the first one is facial pallor, the second one is anemia, the third one is lead line or Bartolian line, the fourth one is colic pain, the fifth one is lead palsy. So lead palsy is seen in 10% of cases, and it is also a delayed symptom, mostly seen in males, adults, and usually The extensor groups of the muscles are affected, but can affect any muscle group. So lead palsy is mostly seen in the extensor groups of the muscles and not the flexor groups. But most of the time it can affect any group, but usually extensor group of muscles are affected. So it will start with the numbness, tremors, and then cramps, and then muscle weaknesses can be seen along with the degeneration of the affected nerve. So it will start with the numbness and tremors and then cramps, thereby further leading to weakness, muscle weakness, along with the degeneration of the affected nerve. So if the radial nerve is involved, then the person will have wrist drop. If the anterior tibial nerve is involved, not tibial muscle, it is nerve. If anterior tibial nerve is involved, then the person can have foot drop. And then lateral atrophy of muscles can also be there, and the recovery from the lead palsy is very slow. So lead palsy is one more thing where it will affect the nerves, and then it will cause degeneration of nerves, leading to paralysis or palsy of the nerve. Mostly seen wrist drop, which is caused by radial nerve paralysis or degeneration, and then foot drop caused by anterior tibial nerve degeneration. So we have 5 symptoms till now. One is facial pallor, number 2 anemia, number 3 lead line or Bartolian line, number 4 colicky pain, number 5 lead palsy, number 6 encephalopathy. Very important, encephalopathy. Mostly it is due to tetrahydride, and then it is seen in children. We have seen lead palsy is mostly seen in adults, whereas encephalopathy is seen in children. So encephalopathy, we have symptomatology like headache, insomnia, delirium, hallucinations, convulsions, and later the person can land into coma and death. It is irreversible. Lead palsy is reversible, but recovery is slow, whereas encephalopathy is irreversible. About 85% have permanent brain damage, and death occurs in 25% of the cases. Very important. So the severest symptom is encephalopathy, mostly seen in children, which is irreversible. Now the reproductive symptoms. So we know that lead affects the reproductive system. In females, it produces menstrual disorders. In males, it can produce sterility, and sterility can be seen in both males and females. Then menstrual disorders are seen in females, and abortion can be seen in females. So usually in first trimester and second trimester, abortions can be seen in females. So reproductive system sterility can be seen in males, and then sterility, menstrual disorders, and abortions are seen in females. And abortions occur usually in the second trimester, 3 to 6 months of pregnancy. CVS and kidney problems can be there. The patient can experience hypertension, arterial degeneration, atherosclerotic nephritis, and then interstitial nephritis. So kidney changes and then CVS changes can be there. And then what are the miscellaneous symptoms? The patient can have an episodes of constipation and diarrhea, dyspepsia, anorexia, loss of hunger. There can be generalized weakness. There is exhaustion, malaise, then irritability, headache, vertigo, and then loss of hair. Loss of hair is also an alopecia. Loss of hair can be seen in lead poisoning. So constipation, these are some of the generalized miscellaneous symptoms. So general weakness, malaise, exhaustion, irritability, dyspepsia, and then constipation or diarrhea, and then loss of hair. So these are some of the the overall symptomatology of chronic lead poisoning. We have seen 6 points. First one is facial pallor, 7 points facial pallor, and then we have anemia. Number 3, there is Bartolian line and lead line on the gums, colicky pain, lead palsy, lead encephalopathy, And then we have reproductive system symptoms, and then we have serious system symptoms, and then we have nephritic symptoms. And miscellaneous symptoms are there is constipation, diarrhea, dyspepsia, anorexia, generalized weakness, irritability, headache, vertigo, and then loss of hair. So chronic lead poisoning, we know that it is also called plumbism or satanism. So this is another classification of dividing the chronic lead poisoning into mild, moderate, and severe toxicity. Mild toxicity, if it is about 40 to 60 micrograms per dl of blood. If the lead levels are about 40 to 60 micrograms per dl of the blood, then we categorize it into mild toxicity, where the patient will experience myalgias, paresthesias, and then abdominal pain. In moderate toxicity, the lead levels are about 60 to 100 micrograms per deciliter of blood, and the patient will experience about abdominal pain, headache, metallic taste, vomiting, weight loss, and then anorexia. So one GAT symptoms will prevail, mostly vomiting, and then there can be metallic taste and weight loss is there in moderate toxicity. In severe toxicity, where the lead levels are greater than 100 micrograms per deciliter of blood, and then here the patient will experience lead palsy, lead encephalopathy, and then anemia and colic pain. So serious symptoms will prevail in severe toxicity. So these are some of the categorization of mild, moderate, severe based on the level of lead content in the blood. So 40 to 60 micrograms mild, 60 to 100 moderate, greater than 100 severe. So what are the diagnosis? So diagnosis is by peripheral smear. We can have basophilic stippling of the RBCs. We have microcytic hypochromic RBCs or anemia can be there. And X-rays, if you take X-rays of the long bones, we can have lead lines at the metaphyses end of the long bones. And then blood can have erythrocyte protoporphyrin levels elevated because of the inhibition of the heme synthesis by the lead. And then urine can have aminolevulinic acid levels elevated, indication of the poisoning in the industry workers. So aminolevulinic acid, if elevated in the urine, it indicates poisoning in the industrial workers. We have erythrocyte protoporphyrin levels elevated in the blood level. X-ray can show lead lines in the metaphyses of the long bones. Peripheral smear can show basophilic stippling and then hypochromic microcytic anemia. So you can see this is the lead line. So this is a growing line. So lead lines can be seen here, where the lead deposition can be there in the growing ends. So you can see here. So you cannot see in the small bones, but only in the long bones. So you can see in the radius and ulna. So treatment is removal of exposure from the site of the industrial area or whatever. So remove from the exposed lead industry. Treatment of iron, calcium, and zinc deficiency can also be treated because mostly it is also associated with other metallic poisons. And then chelating therapy, we know that used when blood levels are greater than 25 micrograms per dl. And then we have known ball, EDTA, and penicillamine are used. And mostly chelation therapy is useful in lead encephalopathy in children. And then we can give thiamine B1 to improve neurological manifestations. Then calcium gluconate for abdominal colic. And then for the rest of the things, you can give symptomatic treatment. So treat the metallic poisons, treat with thiamine B1, and then treat with the chelating therapies like British anti-leucid, calcium EDTA, and then penicillamine. And then you can give calcium gluconate for abdominal pain. And then you can treat other things. So it means because we know that lead will inhibit iron synthesis or heme synthesis. So we will give iron, calcium, and zinc because the calcium is bone affected. Iron is affected because of the RBC synthesis inhibited, and then even zinc deficiency can also be there. So in order to that, we will supplement with elemental iron, calcium, and zinc deficiency. What are the autopsy findings? Autopsy findings are pale skin, emaciation, then Bartolian line, then lead line on bones. So pale skin can be seen because of the pallor. Emaciation, weight loss can be there. Then Bartolian lines on the gums, and then lead lines on the bones can be seen. Mostly it is seen in X-ray. So what is the forensic medical legal importance? Lead poisoning is almost accidental. And then lead-laced wine can cause lead poisoning. Mostly lead-laced wine means the wine bottles which contain sometimes they can be labeled with lead. So this can cause the wine to be poisoned with lead. And then anybody who takes for a long time these lead-laced wine can lead to lead poisoning. So and then bullet lodged inside the body can cause chronic lead poisoning. This is one more thing. So normally the bullets lodged inside the body, we call it as Savonnet bullet, where it will not affect any untoward effects on the body, but lead bullets can cause slow dissipation of the lead into the blood or into the body, and thereby it can cause poisoning. So bullets lodged inside the body can lead to chronic lead poisoning. And most important health hazard is in children because it causes lead encephalopathy. And then it is an important occupational hazard among the workers of plastic manufacturers, garage workers, workers in battery industries, and plumbers. So that's all for lead poisoning. We will look into mercury poisoning in the next class. So the silent features, we know that it affects the heme synthesis. It has pallor, anemia, lead line, Bartolian line, colicky pain. Then we have lead palsy, lead encephalopathy, and then we have CNS symptoms. We have CVS symptoms. We have reproductive symptoms, and then we have miscellaneous symptoms. Treatment is gastric lavage, calcium EDTA, ball, and then penicillamine. And rest of the things is there. So these are some of the gross simplified features of lead poisoning. Very important, has been asked many times in the examination as a 4 marks questions. Please go through the test book and read for yourself. And if you have any doubts, you can ask me in the next class. That's it for today. Thank you for joining. We will meet in the next class. Thank you very much.